Hi, this is Rahul Biju.
And I'm Vikas. Our topic is Alice in Wonderland syndrome. In the 1950s, a middle aged woman felt that she got so big she could touch the far side of the wall and her hands would drop off and disappear. At the same time, a man reported that his head felt twice its normal size and as light as a feather. He also felt that one of his limbs were missing. First described in 1955, Alice in Wonderland syndrome is a perceptual disorder characterized by distortions of visual perception, the body schema, and the experience of time. Neurological disorders affecting both adults and elderly patients, and it is caused due to brain inflammation in patients below the age of 18. The name refers to Lewis Carroll's well known children's book Alice's Adventures in Wonderland, in which Alice feels her body is growing both larger and smaller. The symptoms have both diagnostic and therapeutic consequences that differ substantially from schizophrenia spectrum to other hallucinatory syndromes.
The syndrome is sometimes called Todd syndrome in reference to influential description of the condition in 1955 by Dr. John Todd, a British consultant psychiatrist at High Royds Hospital at Menston, West Yorkshire. Dr. Todd discovered that several of his patients experienced severe headaches, causing them to see perceived objects greatly out of proportion. In addition, they also had an altered sense of time and touch, as well as distorted perception of their own body. Despite having migraines and headaches, none of these patients had brain tumors, damaged eyesight, or mental illnesses that could have accounted for their similar symptoms. They were also able to think lucidly and could distinguish hallucinations from reality.
The foremost symptom of Alice in Wonderland syndrome is an altered body image. The person observes sizes of parts of their body wrongly. More often than not, the head and hands seem disproportionate. And in general, the person perceives growth of various parts of their body rather than a reduction in size. Another most significant symptom of AIWS is that the patient perceives sizes of various other objects inaccurately. The trademark symptom of AIWS is migraine.
Some other symptoms may include a loss of sense of time. For some people, time either passes at snail's pace or might seem to pass too swiftly. Some people experience strong hallucinations and may visualize things that are not there and also get wrong impressions about certain situations. Furthermore, like visual perception gets warped, so does auditory and tactile perception. Facts about AIWS are still unknown, and not many physicians know about this disorder. Typical migraine is an important cause and associated feature with AIWS. A person suffering from this disorder may have distortion and hallucinations several times during the day, and manifestations may take quite some time to subdue.
Reported cases. In 2018, a 68-year-old man reported that moving objects were slowing down and speeding up like in a Charlie Chaplin movie. Sometimes he even failed to see any motion at all. In addition, he perceived colors exceptionally brightened and changing randomly, such as a red t-shirt suddenly turning green, like fairground lights. He also saw objects shrinking or swelling up to an unnatural size, as if he were looking into a funhouse mirror. In addition to these types of metamorphopsia, he developed paresthesia in hands and feet, gait instability, and concentration and memory dysfunctions.
In 1952, Lippmann first described several patients experiencing sensation of becoming remarkably tall or short during attacks of migraine. Lately, same symptoms have been found in young patients with schizophrenia, who referred that she felt just like Alice in Wonderland because of a sensation of shrinking and enlarging.
So, what actually causes AIWS? AIWS is caused by both infections and other underlying conditions. According to a 2016 review, the most common causes of AIWS appear to be migraines and the Epstein Barr virus infections. Some other infectious diseases that cause AIWS include influenza A virus, mycoplasma, varicella zoster virus, among other viruses.
Some of the other causes may also include brain lesions, medication, psychiatric conditions, epilepsy, and strokes. According to a 2014 case study, brain tumors may cause temporary AIWS.
So, how do you actually treat AIWS? As of today, there's no set treatment for AIWS. The course of the treatment for AIWS depends on the underlying cause. If migraine is the source of the condition, doctors may suggest managing migraine through diet and preventive medication. However, if epilepsy is the cause of the symptoms, a doctor may prescribe anti-epileptic. Similarly, if infection is responsible, they may offer antiviral agents. According to a 2016 systematic review, doctors rarely prescribe antipsychotics because, despite the nature of the syndrome, there is no psychosis involved in AIWS. Antipsychotics can also increase the chances of epileptic activity, making a person's condition much worse.